Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you. So welcome to Applied Epidemiology PHS 511. Today we will be discussing the topic definition and concepts of non-communicable diseases. At the end of this lesson, we're expected to know the meaning of applied epidemiology, to define non-communicable diseases and name the diseases, and differentiate between non-communicable diseases and communicable diseases. So what is applied epidemiology? Applied epidemiology is using epidemiologic methods in tracking diseases and its indications in the population with the aim of reducing risk factors and improving health. It's usually the scientific basis of research in public health. In the next slide, we will try and see if we can do an activity. So I want you to look at the slide and then tell me what you think. Before then, epidemiology, what does it consist? Epidemiology consists of non-communicable diseases and communicable diseases. It also consists of other health-related conditions like road traffic accident, female genital mutilation, and domestic accident. They are all components of other health-related conditions which are studied in epidemiology. So here's the activity. What are non-communicable diseases? Just look at the picture and then think about it for some time and before we continue. Here we are. Non-communicable diseases are chronic diseases that are not due to infection. Non-communicable diseases constitute over 60% of global burden of diseases in both mortality and impairment. And among the diseases that are leading in the pack is cardiovascular diseases, cancer, and diabetes mellitus. There will be another activity in the next slide, and I want you to look at the picture and tell me what you think in few seconds. Activity 2. What is the difference between communicable diseases and non-communicable diseases? Okay, so communicable diseases are infectious diseases, while non-communicable diseases are chronic diseases. Communicable diseases require an agent of infection, while non-communicable diseases do not require any agent. Communicable diseases are usually short in duration, while non-communicable diseases are longer in duration. Communicable diseases are usually controlled by taming that source of infection, which is the infectious agent, while chronic diseases are usually controlled through lifestyle modification. What is the level of awareness in the population of non-communicable diseases? Obviously, the awareness is growing globally across the world. However, in sub-Saharan Africa, which is ravaged with a mix of burden of more communicable diseases and increasing non-communicable diseases prevalence, the picture is quite different. As you know, not just sub-Saharan Africa, most of the third world countries, they are ravaged by a mix of the burden of these two diseases as compared to other Western countries. So in summary, we've learned the meaning of applied epidemiology and its components. We've also looked at the definition of non-communicable diseases versus communicable diseases, and we gave examples of non-communicable diseases and try to differentiate between non-communicable diseases and communicable diseases. We also looked at the level of awareness of non-communicable diseases in the population. So in our next lecture, we will talk about causes and predisposing factors of non-communicable diseases. Thank you so much for listening.